Some of the best advice I ever got from an attending physician is to think of the worst possible condition that this patient could have and rule that out quickly, and then everything else can take time. So I think about this still every day after 20 years of practice. So a question I get a lot from families when they are concerned about fevers or bruising or their child is tired and looks tired is, how do you know that this is not leukemia? And I 100% get it. I have been panicked over my own kids. I do this every day. And so these are some things that I want you to know about how childhood leukemia presents and why you can feel more confident when your child has these symptoms, but when to take your child to the doctor. So first and foremost, just one of these symptoms is not as concerning. It's all of them put together. So every day I get families that say they've had a fever or they've been sick multiple times, and how do we know this isn't cancer? I have a friend's child who had similar symptoms and the doctor said they were fine, and then they came back with leukemia. So I want to let you know that childhood leukemia is a disorder of your child's blood cells. So they're white blood cells that fight infection. They're red blood cells that carry oxygen throughout their body, and they're platelets that clot their blood. So these children are going to present as the cancer is starting. They're going to present with frequent infections, but they don't just have frequent infections. They're going to present with feeling really tired. They're not going to have a lot of energy. They might look really pale because they don't have enough oxygen because their red blood cells are low. They're also going to present with certain rashes from the low platelet. So they're going to have a rash called petechiae, which is little purple little bursts underneath the skin that when you touch them, they don't turn white again, they stay. They're going to have bleeding potentially from their nose, bleeding around their gums, and they can bruise really easily. Bruising is a common complaint that I get in children, and another reason why I see parents concerned. Think of bruising in places that there shouldn't be, right? If someone grabs your arm, you might get a bruise. If you bang your shin, you might get a bruise. But if you have bruises centrally, if you have bruises that don't make sense for the injury, or if you have a bruise that's rapidly increasing in size after the injury already occurred, those are concerning signs. So when a child has recurrent fevers, tired, pale, they also have trouble with these certain rashes. They can also have bone pain. Those are the main concerning symptoms with leukemia. Now, we would really like to not wait till all of those are included to diagnose leukemia, but you can't diagnose this until you at least have some clue that something happened. So in order to diagnose leukemia, you have to have changes on your blood counts and peripheral smear. So in order to see those changes, you have to have a lower white blood cell count, a lower red cell count, and a lower platelet count. So you have to have some of those in order to make the diagnosis. My point to this is not saying don't go to your child's doctor for these concerns, but I just want to give you a little bit of confidence that just having bruising isn't necessarily concerning. Just having repeated infections isn't necessarily concerning. Just being tired and pale isn't necessarily concerning for leukemia, and just having bone pain isn't necessarily concerning for leukemia. But if you get some of these starting to come together, that is when we start to get concerned. There's also physical exam findings that we look for, but I'll talk about that in a different video. So I just wanted to give you maybe a little bit of confidence to let you know that one of the reasons why children, you often hear the story that they go to the doctor and they send them home and then they come back, is because they didn't have all of the symptoms yet. And so it looked like a regular infection. That's why we always say, call us if your symptoms change. Call us if they don't get better, because what can be a typical virus in someone can be something much more serious in someone else. If you have any specific questions, let me know.